This is Evan Powell, and this is my public service announcement for Health 412 on HIV and AIDS. Now, what is HIV? HIV is the human immunodeficiency virus. Now, this is just the virus that only humans can contract. No other animals or species on the planet can contract this virus other than humans itself. Now, once you have this virus for a certain amount of time, it gets to the point where it actually turns into a clinical syndrome, which is called AIDS. That's why it's HIV/AIDS. Now, AIDS is the acquired immunodeficiency syndrome. This is actually whenever you start showing your signs and symptoms and you get diagnosed with the disease AIDS. What causes AIDS? AIDS can be caused by coming into contact with an infected person's blood, their semen, their preseminal fluid, rectal fluids, vaginal fluids, and possibly even breast milk. You can get this by having sex with somebody who has HIV and doesn't know it. You can, if you have HIV and you don't know it, and you breastfeed your baby may contract HIV. The most common cause of HIV is actually anal sex. It is the most risky sex activity that you can perform because it is the most common cause of HIV. Now, HIV can be transmitted in many different ways. Sexual contact with an infected person, injection, drug use, or sharing needles with somebody who is infected and may not know it, pregnancy or childbirth, breastfeeding, all transmissions of HIV, blood transfusions, organ donations, organ transplants can transmit the HIV virus, and occupational exposure, or if you're a nurse or doctor and you're performing a surgery on somebody and they have HIV and you don't know it, if their blood comes into contact with you, you could contract the HIV virus. To prevent HIV, prevention ways, the most common is condoms. Protection during sex. This is the most common way to prevent HIV. If somebody does have HIV and doesn't know it, the transmission can be prevented by using a condom or some sort of something to block the skin actually coming into contact with another person's body fluids that does have HIV. Certain treatments for HIV/AIDS is what they call ART, A-R-T. It's antiretroviral therapy. It is just a combination of HIV medicines taken all together to keep the disease at a lull kind of inside of your body to where the disease doesn't take your body over completely like it could. So if you catch it early enough, you might be able to prevent most of the major symptoms from taking you over and maybe even prolong your lifespan, because HIV, once it's contracted, it actually targets your T4 cells or your CD4 cells and your T cells, T cells or your CD4 cells, they're both the same. And those two cells are the ones that actually fight the disease and infections that your body contracts sometimes. So once HIV gets in, it attacks these cells, breaks them down, and cancels them out completely and gets rid of them, and then it takes over your entire body. So once you contract HIV, you're stuck with it forever, basically. Certain symptoms of HIV, people call it the worst flu they've ever had. Very high fever, swollen lymph node glands around the throat area, very sore throat, rash all over the body sometimes, fatigue, muscle pain, and a very, very, very bad migraine or headache. Now, that's just the first stage of HIV. There's actually two stages. The first stage is all the symptoms that I just listed. The second stage is what they call the clinical latency stage, and this is when most of the symptoms in the body actually retract and calm down, so you lose most of your fever, you lose the rash and everything else, and all these things go away, but the virus is actually growing inside of your body at a rate that nobody can predict. So if you do contract HIV, once your symptoms start going away, that's when you know that the virus is spreading. The actual AIDS stage, the symptoms for this stage, once you go from HIV to actually contracting the actual syndrome, and you get the acquired immunodeficiency syndrome, this is whenever you get to that stage, you will encounter rapid weight loss, night sweats, extreme tiredness, prolonged swelling of your lymph node glands, weak long diarrhea, or sometimes maybe even longer. Mouth, anus, or genital sores. Most of these times they're pinkish or blackish, sometimes even purplish color all around the mouth, the nose, the anus, the eyelids. Pneumonia, memory loss, and like I said, all those spots. The spots is what's most common whenever people do contract AIDS. The spots come out all over the place. So once this happens, you know that you've gotten to that point where you've contracted the AIDS. Now, statistics in Lafayette, there have been in 2012 there was reported 683 cases of HIV, of actual HIV and AIDS. 328 of these cases were in the HIV stage, and 355 made it to the actual syndrome stage. In Louisiana, in 2011, Louisiana ranked first among every state in the nation for rates of HIV diagnosis of the youth ages 13 to 19, and third in the nation among ages 20 to 24. That's scary, kind of a scary number. Louisiana's first in the nation of all 50 states for HIV and AIDS. In 2012, there was 33,189 diagnosis of the HIV virus, and there was, of those 33,000, 14,112 of those people actually died. In the U.S. alone, there is more than 1.2 million people with the HIV/AIDS virus. 1 in every 7 of those people that have the virus don't know that they're infected. The most common race, ethnicity, social group that is affected by HIV/AIDS are gay or bisexual African American men are the most seriously affected by the disease. In 2012, 13,712 people died from HIV. And since the count was started, I guess, I don't know what year it was, but 658,507 people have died from AIDS in the U.S., dating back to probably the 80s or 70s. That's almost 700,000 people that have died from AIDS in the U.S. So that was my public service announcement for AIDS and HIV. Thanks.